Hello, my name is Beverly Young, and I am the Director of Perioperative Services.
My name is Arkaime Kess. I'm the Service Line Coordinator and Operating Room here at Baltimore, Washington.
And my name is Paula. Loane. I'm the Perioperative Educator for Baltimore, Washington Medical Center. So we're here today just to describe a little bit about our Go Clear Award that we recently achieved. This journey started a few years ago when one of our vendors offered a continuing education opportunity for our nursing staff. That brought to light a lot of the risks associated with surgical smoke, and we have staff like Arkaime who have been in this environment for
20 years or more.
And have lived this life for that long and been exposed to some of the harmful effects of surgical smoke.
And certainly we definitely want to support an idea like this because it's healthy for our patients, it's healthy for our staff, it's definitely healthy for our environment. But I'd like Arkaime to just go into a little bit of how it has created a healthy environment for our staff to work in.
For our staff, we've been exposed to this smoke for many years without taking any regard to our health. It was just part of the routine, everyday life in the operating room. We had no idea we even carried products that would help us with the elimination of smoke to help save our lives in the future. This exposure to the education brought it to light for us. We spent a lot of time on research before we really brought it out to the staff to let them know what we can do to help save our lives and elongate our lives.
And so we were so glad that Paula really researched this whole thing, our educator here, Paula. She really researched this whole thing and really brought it to us as a project, as an initiative to help our environment. Now, to be realistic, we never went into this worrying about a bronze or a gold award, but quite frankly, we are blessed that we received it. But I'd like for Paula to talk about the research and the education that goes into creating something like this, and also the fact that AORN offers this to their different hospitals for giving or putting in all the work that it takes to be able to get the gold award.
So once the education took place with our nursing staff, we did have a total of 2 CE opportunities for our nursing staff, and began to trial some products that would help in this surgical smoke evacuation in our environment. The staff jumped right on board. This could never have happened with the 3 people standing here. We needed staff buy-in and we needed staff support. And once they heard about what we were exposing ourselves to and our patients, they were 100% behind this journey. Once our products were selected and we moved forward with it, we had the support of our physician colleagues, our anesthesiologists, all backed our work in this initiative. So it really was a team approach, and from Bev right on down to our ORAs, all of our staff have been extremely supportive in this journey.
And quite honestly, even higher than me, some of our leadership, even on the top levels, such as our chief nursing officer, she was very, very involved in understanding and excited about the fact that we received the award. She is a former perioperative nurse, so she did understand the dynamics of having smoke and being exposed to it in the operating room setting. So she was excited with the theory that Paula had brought to us, and Arkaime joined in with her to go for this gold award, and we're just extremely excited about receiving the gold. Now, there was a bronze and a silver, but we're just happy we received the top award, which is the gold award.
And we couldn't have done it without, like Bev said, our CNO, Kathy Whitaker, our newest CNO, David Hunt. We had VP support in this. Trudy Hargett, our operations manager, really helped us to nail down the finances of things. And it really was the staff. We had extreme support from our staff, and this could not have happened without them. So, thank you.
Thank you.